Welcome, everybody. We're going to wait just a minute or two to let more people sign in, but really glad to see folks showing up for the webinar today, focusing on transforming approaches to sheltering people at both the community and the organizational level. So I see the participant room filling up some, but we're going to wait a minute or two before we dive into the content. Thanks everyone for being here. I'm going to wait till my clock ticks over one more minute, and then we'll jump in. So thanks again for folks for signing on, and get started in just a moment. Okay, I think we'll go ahead and get started. The number of participants has kind of leveled off for a little bit. I'm sure more folks will join along the way, but want to respect everyone's time and make sure we leave plenty of time for question and answer. So we'll go ahead and move forward with our presentation. We're going to present for, I would say, the first 50 to 60 minutes or so, but we're trying to leave about 30 minutes for questions and answers that you can pose as we get to that part of the agenda. We'll do introductions in a moment. This webinar is focusing on transforming approaches to sheltering people at the community and organizational level. It's the third webinar that the Reimagining Interim Housing Project team has offered over the course of the last year or so. And the Reimagining Interim Housing Project is a part of the larger Framework for an Equitable Homelessness Response Project. Next slide, please. And the Framework for an Equitable Homelessness Response Project is a partnership of leading national organizations and a few other folks that are trying to help support communities to focus on how to most effectively respond to homelessness while leading with a focus on driving progress on racial equity and toward housing justice. Many leading organizations are a part of this collaborative effort. I especially want to thank the National Low Income Housing Coalition and Kim Johnson, especially there, who host these webinars for us, provide the platform, and help make it possible for us to offer these kinds of sessions. Next slide, please. The Reimagining Interim Housing Project team there's 5 core folks of us. I'm Matthew Doherty. I'm an independent consultant who's been working on this project for the last couple of years in partnership with 4 other partners who are several of whom are on the call today. And we've been trying to help lead the effort to create tools and materials that we'll talk about in a moment, and to support the ability of communities to think about how to reimagine and transform their approaches to sheltering people. Rashima Melson and Donald Whitehead, who are part of this team, weren't able to join today, but they were deeply involved in helping us think through the approach to this webinar and the topics to focus on. And we do have with us today Shondell Diaz and Claudine Sapili. Shondell, do you want to introduce yourself quickly, though I know you're having a little trouble with your voice?
Yes, good afternoon, everybody. My name is Shondell Diaz. I use the She Suite. I am a Latina with lived experience, and I'm also the 3-County Continuum of Care Coordinated Entry Coordinator here in Western Massachusetts. Thank you.
Great. And Claudine, do you want to introduce yourself quickly?
Yes, absolutely. Everyone, thank you so much for joining us this afternoon. My name is Claudine Sapili. I work as the Director of Lived Experience and Innovation for Destination Home here in San Jose, California. Thank you.
Great. Next slide, please. Then we have a few folks who are going to actually do a lot of the presenting with us today. So appreciate the time they've taken to be with us today and to prepare for today. And I'm going to give you all a chance to just quickly introduce yourselves as well. So we have Nan Sibley from the 3-County Continuum of Care in the Community Action Pioneer Valley. Nan, do you want to introduce yourself quickly as well?
Sure. My name is Nan Sibley. I do use the She series, and I am the Community Engagement Coordinator for the Northampton Resilience Hub through community action.
Great. And then also from Western Massachusetts, we have Tim McCarthy, who's representing Craig Stores. I'm going to talk about their efforts. Tim.
Hi, everyone. My name is Tim McCarthy. I'm the executive director of Craig's Doors, which is an interim shelter provider, housing provider out in Western Massachusetts. I'm also a member of the Bioethics and Human Research Lab for UMass Boston.
Great. And then we have some folks from San Jose, Santa Clara with us today. So Ryan Sanders from the city of San Jose. Ryan, do you want to introduce yourself?
Sure. Thanks, Matthew. Nice to meet you all. I'm Ryan Sanders. I'm with the City of San Jose's Housing Department in San Jose, California.
Great. And then from the Life Moves organization, we have Jeff Gallipo. Jeff, do you want to introduce yourself?
Yes, hello. I'm Jeff Gallipo. I use the he suite, he, him pronouns, and I'm the Vice President of People and Culture at Life Moves.
Great. And you will have a chance to hear from all those folks in the just very near future in this webinar. So next slide, please. So just quick overview of what we're going to cover. We're going to give a very quick overview of the Reimagining Interim Housing Project and the process and the materials that are available and some of the core concepts. We are going to do that very quickly so that we focus most of the time on learning about how folks in Western Massachusetts are pursuing efforts and opportunities to transform their approaches, and then also hear from San Jose and Santa Clara County folks about how they're transforming approaches to sheltering people, and again, wanting to leave plenty of time for questions and answers. Next slide, please. Just a few logistics for the Framework for an Equitable Homelessness Response Project. There's website addresses here on the slide where you can see all of the tools and materials that have been created as a part of that project. There's a dedicated page there for the Reimagining Interim Housing, which has all of the materials and previous webinars that have been offered that go much more deeply into the content of the publications and materials and guidance that we're going to go into today. The webinar recording and the slides from today will be posted on that website on the page dedicated to webinars. And I think Kim has had a chance to put a temporary link to the slides in case anyone wants to follow along into the chat box. So you can see the slides, but they will be available on the website. And again, we're going to try to dedicate a lot of time at the end of the webinar to questions. We're gonna, I think I put the guidance, yes, we're gonna ask you to try to pose your questions in the Q&A box rather than the chat box so that we see those questions coming in. But we'll also be monitoring the chat, and if there's questions in there, we'll do our best to bring those into the conversation as well. Next slide, please. All right, so we know everybody who's joined is probably having a very busy day and busy things to do afterwards, so we're going to turn it to Claudine, who's going to ask us to just sort of bring our focus together today for this topic. So Claudine.
Awesome. Thank you, Matthew. Again, welcome everyone. Before we dive into the rest of the webinar, let's take a moment to clear our minds and be fully present. Working in the sector that we work in, I know that's extremely difficult, but for the next hour, actually for the next minute, if I could have your full attention, please. You are welcome to close your eyes if you'd like, if it's safe to do so. And be ready to do the following. You need to breathe in a big breath and let that out. And now imagine you're holding a balloon for each thought occupying your mind right now. One balloon for the last meeting that you just had, another balloon for your next challenge that's coming up after this webinar, and so on and so forth. Now, take a deep breath. And as you exhale, release those balloons and just watch them float away, taking those thoughts with them. As you inhale again, feel the fresh air filling your lungs and your mind. Embrace this moment of clarity and presence. Now, with a clear mind and a fresh perspective, you're ready to fully engage and absorb the insights and ideas we'll be sharing today. Remember, when you let go of mental clutter, you make space for growth and inspiration. So let's make the most of this time together with open minds and full presence. Back to you, Matthew.
Great, thank you, Claudine. I need to remember to do that myself on my own more times during the day. I appreciate that. Next slide, please. Okay, so again, we're going to move through this content very quickly. There's a great deal of information and materials on the Reimagining Interim Housing webpage. The address is, I think, been put in the chat box as well. So we're not going to repeat all of the content that we've covered in prior webinars, but we'll just give a very brief framing. So next slide, please. So for this project, two things that we've been very conscious of throughout is a sense that we have really neglected to focus adequately on how our communities providing high quality, low barrier housing placement focused interim housing options, and how do we support them to be able to do that work better and with more intentionality, and also balancing that with a recognition that just making adaptations and playing around the edges of current programs isn't fully responsive to the guidance that we've been hearing from people with lived expertise, and that we need more foundational, fundamental change, and we need to find ways to pursue that. Next slide, please. So for this project, our objective from the beginning has been to try to create tools and share information that can help communities envision and pursue transformation of their approaches. Not day-to-day guidance, exactly what to do for these kinds of policies, but really more trying to help people think about how do they get from where they are to a vision of where they want to be. Today, you'll actually hear from organizations who are also wrestling with the day-to-day changes that need to be made in support of that larger vision. But we're especially trying to help communities think through how to structure and make change. Next slide, please. For this project, we went through about a year-long process to try to develop the ideas and the information. We did focus groups with folks with lived expertise. We did interviews with leaders from homelessness response systems and provider organizations and national organizations. We then brought together small group discussions to flesh out ideas and the content. Within the materials that I'll show you in a moment, there's a lot of information about what we learned, what we heard, what guidance we're following. Next slide, please. One thing I do want to highlight is for this project, we've been using the language of interim housing, which is directly responsive to what we've heard from a lot of people with lived experience of shelter programs and systems, is that the language itself can be traumatizing. The language itself can feel abusive, can remind people of very bad experiences that they've had in the past. And we've been asked to shift our language and try to find other language that helps convey the intention we're bringing to this work. So for now, we're using the language of interim housing. That might change over time as we think more and hear more and develop more ideas. And sometimes we're referring to sheltering people as an activity, but we are trying not to actually refer to shelter as a place, but it could be an activity or a way that we're supporting people. People need to use the language that works within your communities. We just wanted to be clear, that's why we're using the language within this project. Next slide, please. This project did issue two large major publications at the end of 2022. The first publication outlines the stages and the action areas for transforming approaches to sheltering people and trying to help people think through what might that process look like. And the second tool, which we refer to as a supplement, provides links to many other tools and guidance that can help address the more day-to-day questions, the things that you want to change tomorrow, even while you're pursuing change. So we wanted to balance both creating an opportunity for people to pursue a longer-term vision, but recognizing there were things that people wanted to improve right now. So between the two documents, it provides both of those kinds of guidance and support. Next slide, please. Very quickly, that within the first document, it outlines 3 stages that we think people could use to envision what this change process needs to look like. With the first stage of initiating the work and establishing the vision for transformation. The second stage, focusing on innovating and trying new things and pursuing multiple transformation efforts at the same time and seeing what's working and what's not. And the third stage focuses on iterating, taking what you've learned, trying other things, adapting and strengthening your efforts, with the expectation that people need to cycle through these stages likely multiple times over the course of years, not weeks, not days, not months, but likely long-term effort here. And that throughout all of this work, we need to lead with a focus on racial justice and equity, and we need to seek and follow the guidance of people with lived expertise and people who are working in direct service roles. Next slide, please. Within those stages, we outline 6 action areas to help people think about how to structure their work. First action area focus on identifying and describing the values and the standards that you're seeking to embrace. The action areas 2, 3, 4, and 5 are testing and trying different things around new models or programs and assessing what might be areas for improvement that would get you closer to the values and standards you're pursuing. 4 focuses on what are the capacity building and quality improvement efforts that you can deploy to help programs get closer to those values and standards. And action area 5 focuses on making sure you're connecting your interim housing programs within your systemic efforts to end homelessness, so that there's a really purposeful way that these programs are helping to end people's homelessness and connect them to other resources. And then the 6th action area focuses on adapting your efforts and initiating shifts to other models and likely going back through some of the other stages and action areas again. Next slide, please. I know that's a very quick grounding, but again, there's a lot of materials on the website that can help you dive into all of that content much more deeply, including 2 previous webinars where we walked through the guidance in a high level of detail. So we didn't want to repeat that content today, but hope people access some of it beforehand and can continue to access it after this webinar. So now we are going to shift gears and we're going to start learning from communities who are pursuing this work, who haven't gotten everything done yet. That's not the point of the discussion today, but showing folks who are engaged in this effort, what they're thinking about, what they feel like they've accomplished, and what comes next for what they're trying to change and drive progress around. So first, we're going to hear from Western Massachusetts folks, and then we'll hear from San Jose folks, and then we'll turn to questions and answers. So I'm going to turn it over, I think, first to Shondell to get us going into learning about Western Massachusetts efforts.
Everybody, thank you, Matthew. Next slide. So what I want to identify first off is that because of this process, because of working as a part of this work group and the co-creators of this, these basic pathways to initiating change and making change, we started in the 3-county COC, which covers 1,600 square miles of rural parts of Massachusetts, is Hampshire, Franklin, and Berkshire counties. And we, again, started a year ago, and this, we're still stuck in the first stage, which is the initiate stage. It's basically establishing the vision for transformation. Next slide. Nan?
So in our local efforts, the 3-county Continuum of Care initiated a collaborative by gathering a dedicated work group consisting of local partners like shelter providers, DV providers, transitional assistants, people with lived expertise, and community advocates. This collective has been advancing the ongoing initiatives of reimagining interim housing framework within our own community. Recognizing the significance of this framework, the work group has experienced a deeper understanding and meaningful traction of its principles in the form of an action plan. Through these meetings, we've been having the difficult conversations, listening, holding spaces for the experience of all involved in the process of stabilizing lives through interim housing efforts. Next slide. So why pursue the transformation? There are, Shondell, this is you?
Yeah, so we were able, doing this work and looking at what the fundamental pathways and guidance is from the Reimagining Interim Housing Framework, it was easy to say, this is something that we need to take on. We were already leading with racial equity, right? Because we created in 2020 a racial equity plan with the help of consultants from Racial Equity Partners, Donald Whitehead and Jeff Olivet and Kavita Gilchrist. But in that process, we already knew that we needed to pursue more transformation. It wasn't just making sure that we're focusing things equitably and just and providing justice. It was making sure that we're actually listening to the voices of people with lived experience and making sure that they're at decision-making tables and understanding that they are the experts because they're the ones that have gone through our systems of care. So with their guidance, with other service providers, with advocates, with DV advocates, we were able to understand that we needed to continue and pursue transformation in this way. Next slide. So how did our community organize itself to pursue change? On here, you'll see that we have many local partners, and this is not even a quarter of the partners that we have working towards systems change. We have many, many partnerships and strong partnerships that we've created over the years to make sure that we're focusing primarily doing things with an equitable lens, but also making sure that we're doing things in a trauma-informed way and a housing first way. And this work group came together because of the awesome work that we're doing within other community collaborations. The COC many times are seen as just the people that are heading or working for the COC itself. The COC, or the Continuum of Care, is not just that. It is the membership. It is the people we serve. It is the frontline workers. It is the service providers. It is staff. It is advocates. It is everybody. And bringing together this group was honestly the easiest part of this process. And again, making sure that we engaged with people who lived experience through our People Who Lived Experience Action Board that was created a year ago now. We were able to bring those folks to the table and make sure that they're making change and that their voices are being heard and uplifted and empowered. Next slide.
So this is the iceberg model that we used within our group, and this is the roadmap to how we established our discussions and what we wanted to explore. We started with events, the things that we're seeing, naming it. What are we seeing? What are the barriers? What are the difficulties? And the next slide. This was a year-long process for stage one. We are coming near the end of it to move into the action plan. And I can't state enough how critical it is to hold space for those difficult conversations. The difficult conversations take place during this journey. And the slides we're going to show you reflect the actual discussions that we had within our group, our own work group. When we talked about the events, the things that people were naming, providers having difficulty trusting other providers, having trouble making those referrals because they don't trust what's going to happen on the handoff, organizational issues, crises that happen during the Super Bowl. It's not business hours. So taking a look at and just discussing and naming when crisis happens, what those events are. Next slide. And the patterns, the events that reoccur. So the things we see over and over again. High staff turnover, scarcity of resources for marginalized identities especially, and everyone and everything is at capacity. I don't think that's a unique situation just to our area, but it's important to name these things again and to hold space and have a discussion for them. Next slide. The underlying structures are what shape those patterns. For us here in Western Massachusetts, funding sources dictate policy and data collection practices and minimum infrastructure and wage capacity. These are just touching the surface of the things that we discussed that again trickle down to a larger systemic issue. Next slide. The mental models that shape those structures, the ideas and the bias that underline attitudes and actions, that homelessness is a matter of financial literacy and drive, or people are lying in the bed they made, so they have to fix it. Or, in fact, our culture is riddled with oppressive systems, and we're living in an ever-growing housing crisis. Next slide. Cultural and institutional values, what shape those mental models. If you work hard enough, you'll achieve your goals. Asking for help means you're not capable on your own. Or white supremacy. Issues cannot be addressed or adjusted if they're not named. We name them in order to call them in and begin working and building a community of functional and trauma-informed systems around them. So have these difficult discussions with your groups, hold space for them. It's hard to hear when the work that we do is in our heart and it's our calling. We love what we do and we love the people that we work with, and to hear that we're falling short, it's hard to do. And this process brings everybody into the same space that has that shared value of that exactly, and how to do it, and how to have an impact, a meaningful impact on your community, and how you want to move forward with a shared vision of how to change your policies. Next slide.
So we were very fortunate. The Reimagining Interim Housing Framework itself does not provide funding sources. But with the work that we have done in the past with the Massachusetts Housing and Shelter Alliance, otherwise known as MAHASA, in May of 2023, we were awarded with a Place to Live one-time grant in the amount of $12,000. $12,000 may seem minimal, but when you're just starting out, it gave us enough to get started on the work and to move forward. And on the slide, you will see, and you can read a little bit more about Place to Live, but these funds have been used throughout fiscal years 2023 and 2024 by the 3-county continuum of care to support the Reimagining Interim Housing Initiative. Specifically, the funds were used to support upgrading our Talent LMS training package, which is a training platform. What we were seeing was that Clara would be doing a training on trauma-informed principles in care in one way, in one teaching style over here. And then over here, you had Lewis doing the same training, but with a different training style. And people were getting mixed messages. They weren't completely understanding the dynamics. They weren't understanding the core functionalities and the basics of what trauma-informed care is. And that's just an example. Kara and Lewis do not exist. But what we found was that there was a need to create a uniform training platform where people could get uniform trainings across the board. And these trainings we were able to create, so that we were able to create and facilitate ourselves as groups, as a community, but also to upload them to this training platform so that everyone had the same exact training. It was also used to integrate people with lived experience into the initiative by being able to pay them stipends, right? Valuing their voice, making sure that you're uplifting and empowering their voice, making sure that their voice is heard. And again, they are the experts. They have gone through our systems of care. They know best. And then third off, providing online training access and Chromebooks. So we were able in the last year to provide PLE who needed them tablets. And we were also able to provide a HP laptop as well as a Chromebook, which is currently being housed at the Resilience Hub Friday early morning breakfast for those that are unhoused, and it's there for whoever needs to use it for whatever reason. The funds have enabled our community to improve our approaches to sheltering people, and it will continue to work on the goal of ending homelessness throughout through provision of more quality housing and the supports that people need. Next slide. So how did the Reimagining Interim Housing concepts and materials help us? The framework itself is a pathway. It is a path to how you should address things. It gives you solutions and well, not solutions so much. It helps you to form solutions. It helps you to work through those hard questions that you may not even knew that you had to ask before. It makes sure that you're not only looking at things with an equitable lens, but also making sure that you're including and incorporating the voices of people with lived experience. Next slide. And as we stated previously, the Reimagining Interim Housing Work Group is working on compiling everything that was identified in the iceberg and creating an action plan. Now this, again, as Nan stated, has been a year-long effort, but these conversations, it's like they're so educational and they're so enriched with positiveness and just identifying what really needs to change within our system of care. That it's the vision, it's the goals, it's everything that we want to make sure that we're able to develop. This plan will be a well-structured community action plan that will be a living document and will be adapted as circumstances change and as progress is made. It will contain goals and objectives that will be specific, measurable, and time-bound goals that the community aims to achieve, and objectives that break down the goals into smaller, actionable steps. A summary of our plan's key points and a call to action for the community will be sent out once we've completed it. And next steps are the roadmaps for ongoing community engagement and implementation. Next slide.
All right. Thank you so much, Shondell and Nan, for sort of setting the table. Can you guys hear me okay? Great. So again, my name is Tim McCarthy. I am the executive director of Craig's Doors. The organization established in 2011. And for a long time, we had developed a relatively strong reputation as being the low threshold shelter. In sort of previous eras of service, they might call it a wet shelter, but we took a really strong harm reduction lens. And at the time of our administrative swap, about 2.5 years ago, we were running 2 seasonal sites, but we had an overwhelming sort of lack of consistency in terms of culture, a shared philosophy, conversation surrounding values, and just a broad organizational culture that also lacked basic infrastructural pieces. Next slide. So for us, I'm going to try to sort of be as concise in describing the history as I can. But the reason, the impetus for pursuing transformation along the lines of the Reimagining Initiative was an organization that had been around for 11 years, but still lacked an identity. We were looking at historical organizational trauma. The management style of the previous administration had left a lot of folks feeling sort of unsafe in the workplace, particularly as it related to how we engaged with guests. As I'd sort of mentioned, the lack of intention or philosophy surrounding how we engage with guests, how we do the work, those conversations were really lacking. We were also met with really overwhelming financial and compliance issues. So we hadn't filed taxes for 2 years. We hadn't had UFR audits performed for 2 years. And so we were really sort of in a state of disarray. But what we did have was a really promising team that was really interested in sort of rebuilding and reimagining how this work could be done. So the co-creation of change started initially with a focus on staff and sort of reimagining departmentally, what are we lacking in terms of supporting folks? And this started initially with a transition from being overnight and seasonal to becoming a 365, 24/7 program. And so another part of that sort of impetus was recognizing that the housing first model is wonderful if there's housing, but when there isn't housing available, we wanted to try and sort of take that same principle and do our very best to create an environment that was dignified and safe, with a person-centered, trauma-informed intervention approach, and just a culture of compassion, and folks taking care of each other across the board. Next slide. Great. So the primary ways that the framework really helped us are in multiple ways, but primarily providing the language to a lot of the ideas that we were sort of organically cultivating. And then providing us with a framework for development, assessment, and evolution of the solutions that we'd sort of implemented. And I have quite a few of those listed here. So again, the transition to go from year-round 24/7 was a product of just listening to the population that we serve. And we do that in a lot of different ways. We have a staff that is like remarkably suited in terms of lived experience, everything from the executive director to departmental directors, to direct care workers and case managers, but also putting them in positions of influence, like ensuring that they have access to our board, and more importantly, engaging in regular surveying of them, whether it's through a case manager or through a digital application, to make sure that they're perpetually having the opportunity to let us know how and where we can improve. Another big gap for us, we had talked about issues surrounding employee retention and recruitment and just turnover in general. At Craig's Doors, we recognized that we're asking people to do this incredibly difficult work that really requires compassion and empathy and being present. And it's really hard to do that if you're not sure you're going to make rent. And so we ensured that anyone who works at Craig's Doors will start at least $20 an hour. We also capped the executive salary. So no executive director at Craig's Doors ever will be able to earn more than double the lowest paid employee. So should I go away and someone take over the organization and go in another direction, they won't be able to pull themselves up without pulling everyone else up at the same time. And that has sort of closed the ownership gap organizationally, and has allowed people to really feel like they're a part of a thing rather than just sort of serving an initiative or a practice. They're really a part of it. We also implemented a director of diversity, equity, and inclusion, because that was really critical to us. And then a lot of it was just, again, reframing concepts. So instead of having site rules, we developed a guest bill of rights. In terms of our programming, rather than being just a harm reduction program where we got as many people in as many beds as we could without any real support, we developed a really robust case management system. We're working with local experts who focus on pre-engagement, which is an intervention approach that's focused on individuals who are still in a state of being unhoused. And then we also really focused on sort of expanding both our programmatics. We went from an $800,000 budget to about a $3.5 million budget in 2 years. We introduced the only free transportation initiative that's administered by an interim housing provider in the United States through our Fair Access program. We collected that data in a very intensive way, and we're able to share that reporting. As a potential byproduct, we're not taking full credit, but now the transit system is free to every member of the community for the summer as a pilot program. But we found that, again, engaging with guests and identifying that, sure, the shelter is now a nice and safe place to be, but I don't want to be totally isolated and I can't afford to get out of here. So we started working with the PVTA. And that particular instance is also an example of one of our values, which is really inspiring and encouraging our staff to bring whatever they're passionate about into the work as well. So that transportation initiative I just shared actually started as a homework assignment for one of our staffers who went to UMass. And again, sort of holding him up and encouraging him to be an agent of change, we turned that into a real program. And as a product of that, now we have staffers from every department in every direction trying to bring in things that they care about into this broader community. Next slide. So in terms of what's next for Craig's Doors, and I know that I did sort of a sweeping overview here, and I'd love an opportunity to answer any and all questions. But we're just continuing to identify ways that the system itself is broken and finding innovative solutions for those challenges. So as an example, when we first took over, when we were so committed to eliminating hierarchy and being as democratic as we could, that proved wildly inefficient. And so now we have more of a representational model where everyone's voice is still heard, but more so at the end of policy development than at the beginning. A lot of it was also about some of the unseen components and ensuring that everyone's cared for. And the best example I have for that would be privacy. When the current administration took over, there was a single Google account that everyone in the organization accessed that had personal information in it. It made it impossible for us to sort of monitor what changes were being made to documents or policies that might live on the drive, because again, there was only a single account. We transitioned to Microsoft 365, and we were able to be much more mindful about how guests' information is being shared. And most importantly, we've engaged in an informed consent policy so that any sort of sharing of that private information is first approved by the guest. That same approach to sort of informed consent applies to our behavior modification approaches. So when folks are in conflict with one of the site rules or in conflict with another guest's rights is sort of how we would frame it. We sit down, we co-create a behavior change form. So just identifying the problem, what is causing the problem, how can we help facilitate ensuring that the problem does not sort of show back up, and here's the repercussions for when they do. The most exciting part of our future for us is the town of Amherst has allocated a permanent location. We've never had a permanent home year after year. We've been moving to different churches and having to focus on developing different landlord relationships. But the town of Amherst has procured a site for a singular housing center, out of which we'll be able to include trauma-informed design with the architects and continuing to engage folks with lived experience, particularly our guest population, through our one-on-one case management initiatives where we're able to have more of a dynamic dialogue, and then also through the distribution of surveys, which we do at least quarterly. They're both comprehensive in terms of how are things going, and open-ended in terms of, you know, how could things improve, or what would you change, or what do you feel that we're missing? I know that this is a bit of a quick overview, but it's really been a pleasure to work with Shondell and to work within the context of this framework. I cannot express how critical it's been in helping to drive us forward into a sort of unified understanding of the work and ensuring that the values with which we do that work and that inform why we do the work always remain at the top of our lens. We're always sort of engaging through the lens of those values and those principles and doing our very best to live them every day.
That is great. Thank you. So now we're going to go all the way across the country to San Jose and Santa Clara. And I think, Claudine, you're going to open us up a little bit, grounding us in the efforts there.
Yeah, absolutely. I definitely think that was a lot of information, amazing information with what our colleagues in Western Massachusetts are currently doing. Deep breath, let it out, make sure that those balloons continue to float away, right? So as we've seen, that Reimagining Interim Housing Framework provides a powerful roadmap for envisioning and pursuing the transformation of community approaches to sheltering people experiencing homelessness. While the efforts we're about to explore now in San Jose and at Life Moves aren't an exact step-by-step of implementing the framework, I think you'll see how they are leveraging key elements and concepts from the framework to continue driving meaningful, ongoing transformation of their interim housing approaches. They're embracing client-centered, trauma-informed philosophies and fostering cultures of safety, learning, and lived experience integration. In doing so, I really believe that they embody the framework spirit, using it to guide innovation rather than as rigid steps to follow. As we explore their transformative work, consider how you might adapt the framework's principles to drive positive change in your own community. Without further ado, here's Ryan Sanders from the City of San Jose.
Thank you, Claudine. So I wanted to begin by providing an overview of the City of San Jose's emergency interim housing programs. They're not linear. There are differences in them. I'll point those out, and then we'll get into the background a little later, and then I'll talk about our next steps forward. So first, emergency interim housing it serves as a temporary shelter and a pathway to permanent housing. These feature non-congregate private rooms with lockable doors, and they include intensive support services that is focused on supporting participants to build self-sufficiency and prepare for transition into permanent housing. Those services include things like case management, housing search and placement, employment services, medical and behavioral health services. In some cases, those are provided on site, and others we triage. And something we call housing problem solving services, where we include funding to try to swiftly resolve someone's homelessness experience with homelessness when they enter the shelter. I wanted to point out these are costlier than traditional shelter models. But typically in our jurisdiction, we see that they're a little more successful in key areas. One being those transitions to permanent housing for the participants that enter. So typically they're seeing a higher percentage of folks transition into a successful placement after the program. Next slide, please. So the supports around the emergency interim housing sites. So for program foundations, professional site management, we encourage our and creativity within our operations. So we have several different providers. They approach it differently. There's consortiums between property management entities and support service entities. In some cases, our partner that you'll hear from Life Moves actually are able to handle both of those services on site. They lead with trauma-informed care and support, really focusing on individualized services for clients and supporting them wherever they're at in their journey. And that's part of our continuity of care between outreach done to entering the shelter to receiving services until we can find a successful placement for them. All of our programs allow pets, in some cases, multiple pets. We try to problem solve around participants and their needs, and then also lower those barriers to entry to make sure that everybody can access the services we have. Employment support, access to clinical services and housing navigation, as I was stating earlier. Their service plans are individualized per participant or household, and that's through, the direct service staff really engaging with the clients and figuring out what their goals are and how to best support them. And then ultimately the goal is for people to exit to stable housing. That's what we consider positive exits. We focus on that in our discussions with our operators and our planning of the sites, and that's really what this is all centered around. For the amenities, so we do provide 3 meals a day at our sites. We make sure to budget for that and ensure the operators have what they need to do so. There's also kitchen facilities on our emergency interim housing sites. These are shared between participants, so they're communal, but it gives them a space to prepare their own meals and hold their own groceries, just like if it was their home. There's privacy, of course, through the locked doors and individual units. Space for their pets, so we provide like a dog run is what we call it, like a pet relief area. There's outdoor space and community space, so we're really intentional about the congregate space we build out in our sites to make sure there's somewhere for people to commune. A lot of our operators like to hold workshops there, community events there. There's on-site laundry services that are free to the client. So we make sure there's laundry buildings. You can imagine kind of like a laundromat where there's many machines and people get to go and do their laundry, but free to them to encourage the use of it. Obviously, the services and case management are a mandatory thing we include. And then Wi-Fi are also free to the clients so that they can use any technology to navigate the resources and work on their housing plans or anything else just for leisure. Next slide, please. Okay, so a little background on our sites. So in September 2021, our city council directed staff to deliver 1,000 beds of emergency interim housing. and 300 beds through the state Project Home Key program. Home Key is essentially a funding grant that requires us to basically reconvert like standing motels into transitional housing that eventually turns into affordable housing. Since 2021, City of San Jose staff delivered 634 beds of emergency housing. That includes 80 in bridge housing communities. Bridge housing was our first iteration of interim housing through City of San Jose. They're only designated for single adults, and these do not have in-suite restrooms. 440 beds in emergency interim housing communities. And we also have 582 more beds in development. And so trying to meet that goal of 1,000 beds, but these do have the in-suite restrooms. Our typical model is to try to provide in-suite restrooms because we found that clients have that need, and we want to be able to provide a safe space for them to live. And so for bridge housing communities, just a little bit about our strategy around it. We try to put lower acuity clients that don't quite have the need for the in-suite restroom and are able to use like a communal restroom building. And then we have we've delivered 114 beds of temporary housing through Project Home Key thus far. And we have 339 more beds in development. All of these sites vary on the types of families they serve. So the bridge housing communities can only serve single adults, their individual units. The EIH communities, the emergency interim housing, they can serve a variety of folks. So they serve single adults, couples, and we have a site that serves families with minors. And then currently our Home Key serves single adults, couples, and there will be one that is able to serve multi-generational families, so a little larger household that are still adults. And then as for funding, so funding varies a little bit, but mostly what we find our success or what we use to provide ongoing operations are local funds. There's a property transfer tax that we use. It's very flexible, so it allows us to, fund different types of aspects of our program and be a little more creative around the services we can have there. We also heavily utilize state funds such as the HAP grant program. So that's through state of California. It's Homeless Housing Assistance and Prevention Funds. We're in its 5th round, and it's dated back to 2019, essentially when we established the bridge housing communities. And then federal funds, there was like one-time COVID relief and CARES funds that many of you might be familiar with, but there was no federal entitlement funds that has ever been used to operate our programs. Next slide, please. In 2022, the City of San Jose and several partners worked together to develop a study, an internal study. This was led by a local nonprofit, Homebase, and Homebase supported and led the effort on the study to engage operators, clients living at the sites, and other stakeholders to identify promising practices, essentially, that we could maybe scale to other sites. So Homebase and worked with the Lived Experience Advisory Board, which was established by Destination Home, to conduct these interviews with the participants, staff, and other stakeholders. The study was not just limited to the interviews, but I'll get into some more stuff about the study. What we heard, though, first was residents appreciated having a private lockable unit. So that's something obviously we're prioritizing to make sure that that continues in our EIH sites. They viewed the sites as secure places to regain grounding, stability, and integrity, and to focus on bettering oneself. And one resident said they see the interim housing as a place to build back a foundation of health. Use this time to heal and recover from being on the streets so that they can regain employment once they are healthy. So these so this is essentially kind of like a collection of what we heard through residents. There was all sort of feedback and experiences we heard, but really we wanted to focus the study on the participants actually living there, empower them to provide the feedback that we were going to find useful to be able to re-implement into our programs to better serve them. We feel that if done in a person-centered way, interim housing is an opportunity to provide people with dignified temporary housing. And if you're interested, I have the link there to the full report of the study that we did. I'd like to add the study was comprehensive. It included analysis on all aspects of our programs. That includes the staffing, guiding principles, empowering the participants, as I stated, addressing healthcare, property maintenance, providing avenues for feedback, and many other things. So I encourage you to go look at that report if you're interested. Next slide, please. And so the city of San Jose compiled things we learned from the report, and we re-engaged with Home Base again to develop a standard operating guidelines document. This essentially set the minimum standards for services and operations at our site. All that we put into the guidelines document was to provide operators with exactly what we're looking for whenever they're going to take on a project of emergency interim housing. It includes a lot of the things that I just kind of touched on in the previous slide that we got analysis on. It includes those best practices and promising practices learned from the study. We included this document in a procurement based around these standards that we're currently engaged in to solicit for operators at our sites. That's for 6 current sites we have and 1 upcoming site that we're developing that should be online in 2025. Again, just restating that this is centered around the empowerment of residents at the sites to best support them to make the program more successful. Next slide. So just to finish off, I wanted to provide kind of an overview of like our continuum of bridge housing that we've done. So specifically the top left, that's our first iteration, our Mayberry site. That is there's no in-suite restrooms. A lot of folks call them the tiny homes. And so a lot of it's centered, like we have communal buildings for laundry, kitchen, the shower, and bathroom buildings are communal there. And it's one of our smaller sites, so only serving single adults there. The top right site, that's actually our first development of emergency interim, our second development of emergency interim housing, Roof Ferrari. That site serves singles and couples, and you can just see how much larger the site is, the different style of modular buildings in there. Rooms are larger, they have the in-suite restrooms, and we had learned quite a bit already, so we were more intentional around the community space and the different amenities at the site. The bottom left site, that was early stages development of our family site at Evans Lane. So this one serves the minors with the families. And so you can see like the playground area there, and then we work with the operator to ensure that they're providing child-centered services as well to best support those families. And lastly, is our newest emergency interim housing site at Guadalupe. And here we partnered specifically with Destination Home and the Lived Experience Advisory Board of Silicon Valley that I referenced earlier in the design stages of this site, and working with the operator that's going to that was gonna start operating the site to develop guidelines around the site and really empowering that voice of lived experience and their expertise to try to determine our best route forward with emergency interim housing. So here you see like the nice colors, but there's a lot more that went into it. I'm gonna pass it off to Jeff to talk about that. And thank you, everybody.
Hello, everybody. Thank you, Ryan, for that great transition. And actually, on the next slide, you will see the Guadalupe site again. A beautiful site that Life Moves is thrilled to be the operator of, and the process of the work that we did with the city and with the Lived Experience Board was humbling and wonderful, and indeed was a catalyst to organizational transformation. And really, if there's a specific angle or an aspect of this work that I can speak to most passionately today, it is making sure the organization itself is really ready to be a fertile ground for these ideas and this work to take root. Life Moves is a venerable, longtime provider. It was formed out of the merger of 2 organizations that had been around for decades. By some measures, one of the 2 entities that became Life Moves is nearing its 50th anniversary. We have close to 500 staff and operate 26 different sites and programs across 2 counties. As they say, when you need to start turning an oil tanker, you start miles and miles and miles from where you actually need to get to. And I am here today, but I am the HR guy. You know, program work is not my background and my expertise, but organizational cohesion and change management is. And that is where much of the inner work of our agency was rooted. And when we move to the next slide, when we talk about the processes and pivots that we needed to make as a provider to truly iterate to our next version of ourselves and participate in what was happening in the ecosystem around us, our work with San Jose and with the Lived Experience Advisory Board on the Guadalupe program guidelines was absolutely vital. And I will just tell you that initially that work was fraught. Claudine is smiling when I say that. And about halfway through the process, our CEO took a pause, asked me to get involved with the working group. And internally, we really refocused our efforts. And from then on, the process moved in a really different direction. And the learnings from that work were deeply inspirational to us to look at all of our programs, policies, and procedures. And has indeed been a real catalyst to organizational transformation. I will be deeply grateful to Claudine for a long, long time to come, because that proved to be a very important moment for Life Moves as an agency. Having the humility to really take a step back and be open and truly participate in that process. Another really important strain that has made it possible for Life Moves to show up in the right way for this work has been clarifying the relationship of our lived experience work and our DEI work. Like many folks on this call, no doubt, the Supreme Court affirmative action decision and a range of challenges and complications that have emerged since then altered very much the plans that we had for what our ongoing DEI work was going to look like. And as we dealt with some of the new guidances and concerns and legal realities of what was going to be defensibly possible in the future, we started to realize how many of the tools of lived experience work were similar to the tools of DEI work. And we conceived of our DEI work as an extension of, as our lived experience work in a way, as an extension and as a phase 2 of our DEI work. And that was very powerful in creating organizational cohesion behind this work. Similarly, this organization had had barriers to employing individuals with lived experience that were unacceptable and unnecessary, and rooted in single incidents that occurred years ago that now lived on forever in policies that no one could explain. So for example, we had a 1-year wait period in order to be able to employ someone who had come through a Life Moves program. There was no real reason for that, and it was something that was I gladly sunset at Life Moves, and allowed us to really then actually build a proactive recruiting pipeline, including special recruitment fairs that are designed to be held remotely at all of our sites and programs that recently debuted and are proving to be very successful, which is really exciting. And then understanding how we want lived experience to influence and impact our decision-making at Life Moves, which I'll talk in a minute. And all of this, of course, fueled our organizational change and our community collaboration. Next slide. A really vital part of this work that I cannot underline enough the importance of this step was learning about ourselves as an organization. What I'm showing you here on this slide is a question that we actually asked this year for the first time on our employee engagement survey. 2 different groups of behavioral health experts worked on this question. This was maybe the most worked on question in the history of employee engagement surveys, but we wanted to ask a lived experience, lived expertise question that did not reference lived experience, and that gave everyone an entry point to being able to answer and engage with this question. And what we learned about the distribution of lived experience across our agency, which, by the way, when we break these numbers down by organizational levels, these are true at our executive suite as much as they are with our direct service staff. So an extremely humbling bit of self-knowledge for Life Moves. We had only really had this information anecdotally before this year. But to learn that 30% of our staff had had periods without a permanent living situation is a point of knowledge from which there is no going back, that changes both how we think about ourselves and how we talk about our work. It is easy for nonprofit organizations sometimes to talk about mission alignment, but this is where data meets mission alignment and allows us to really make mission alignment actionable in the way that we talk about our teams and advocate for our teams. Next slide. This also led to the development of 3 incredibly important guiding questions. When we are refining policies, developing new policies, reviewing handbooks, when we are approaching new material that we are creating, we are now using these 3 questions with everything. So in a way, in a simple way, we thought, can we operationalize some of these insights quickly in a simple way that can be scaled at every level of the organization? And these 3 questions allowed us to do that. Essentially what we're asking is this thing we're talking about clear? And does it provide a sensible explanation? Is it clear, simple, and concise? And does it consider and respond to cultural and historical issues relevant to the target population? Again, we will probably iterate this, but this was where we have started from, and it has already been incredibly powerful and clarifying in a range of situations where we have been needing to create documentation that doesn't exist, create new materials, both for things that are client-facing and things that are staff-facing. Next slide. This slide zhuzhed a little bit, and my apologies, everyone, on that. But I want to jump back for a minute to the work that we did with the Lived Experience Advisory Board, which was so humbling. And I actually want to share that the work of creating those guidelines, certainly for me personally, helped me see things in a new way. And there's just one insight that I want to share. When we were talking about, we had a section of our guidelines that talked about health and wellness checks. And in the language of those guidelines, we both talked about checking on individuals and checking on the spaces that individuals were occupying. And someone pointed out to me in one of the meetings that by linking those 2 concepts in the same section, it was perhaps making that individual feel like we didn't really care about them, that we were just checking on them in order to be sure that the space was okay. And that was a real moment where I myself personally took a step back and was like, okay, wow, a light bulb has gone off here. I get this. And going forward, then we decoupled those 2 sections in our guidelines. And I just use that as an example of something that we had never questioned, never thought about, and never realized the impact until it was brought to our attention there. And so those ideas and others have helped us to create an actual client engagement philosophy. Next slide. And this is both an actual operations manual and also a statement of values and purpose that takes into account the lenses that we believe we practice, the approaches that we try to reinforce, and a cultural model that we try to espouse. And you can see here kind of the main points that we tried to bring through each of those lenses. So while it also functions as an operations manual and will give like a program director guidance on how to deal with a situation that comes up, it has also been reviewed through a trauma-informed lens and has incorporated the voices of experience into the language and even the way the document is laid out. Next slide. And this work has also had a lot of implications for talent development and training. We have had to think about how we recruit, train, and grow in a lot of different ways. From creating pathways of employment for former clients, to making sure that those questions that I showed you are asked at every level of the organization, clarifying our policies and procedures, developing a new training toolkit of what are the skill sets that we are trying to empower our teams with to do their work, but also to creating specific systems for incorporating feedback. And here, for example, on the staff side, we have a lived experience employee resource group within Life Moves that is one of our most popular and successful employee resource groups. And we engage with them to consult on a range of different concerns and issues. And recently, a consultant was going to deliver an organization-wide survey and actually brought it to that group for their input before it was distributed organization-wide. That has been a really transformative way for us to begin creating a safe space to engage with staff lived experience. And then we are also being very intentional and thoughtful with how we are engaging with lived experience from clients and participants, and also understanding the ways that that is different than the lived experience of staff. And that is where I think, just even in recent weeks, some of the learnings and provocations have been most interesting for our organization. The insights align and diverge in ways that I think are pointing us toward some really cool things that we'll be excited to talk about in the future. Next slide. So from an organizational cultural standpoint, there are a range of things happening within this organization that are not isolated. We have been really reimagining how we engage with lived experience, but at the same time, we have been espousing a new training curriculum that has been informed by the ideas of radical hospitality. We have been investing in the skills of our individual program directors and people managers. We have been focusing on the experience of the one-on-ones those people are conducting with our direct service staff to make sure that time is used effectively in order to assess and impart skills and develop goals and engage employees. We've been focused in a range of areas on cultivating environments of psychological safety to normalize and surface insights of experience that people bring to this work. We've been focusing on employee wellness. We have been revamping our organizational theory of change. All of this has been happening together. And all of this, these bubbles here, there's sort of an umbrella over the top of it, which is the culture of the organization iterating in response to all of these inputs. So what has happened in our ecosystem, what has been asked of us by our funding partners and other community collaborators has really moved us through taking these steps to actually iterate our organizational culture. Often a hard thing to talk about or to talk about as a process. I hope I have done it justice in the time I have here. I realize I am at time, but I'm very excited to talk about this work and these insights through this lens, because I think it is often the missing piece. The model lives because of the people within the model. And I will close on that sentiment. And I thank you all for your time today. This was really educational for me, and I'm thrilled to get a chance to talk about the work that we're doing here.
Great. Thank you so much, Jeff and Ryan and Claudine, for talking about the work there. So this is a great time to put questions into the Q&A box, and we're going to get to them as many as can. I will admit I did a bad job at the beginning of keeping us on track for time. I underestimated the amount of time for opening, but we still have a solid 15 minutes here for questions. And if we don't get to questions, or you don't get a chance to ask your questions, there'll be an email address you can send questions to afterwards as well. So I'm going to start keeping an eye on the Q&A, so please do put your questions in there. And we do have a question that's come in already about how have these changes also filtered up to respective governing boards, including their composition, decision-making model. So how is it influencing not what's happening necessarily just within the staff who work in the day-to-day programs, but what's rolling up about these changes to the boards and the governance of these efforts? So is there anyone who wants to tackle that, either at the organizational board level or within community COC governance board kinds of changes. And anyone have a response to that question about kind of how you've, oh, Tim, I see you want to jump in. Go ahead.
Sure. I think I messed up in the Q&A section there, but regarding Tom's question, how these changes also filtered up to respective governing board, including their composition, decision-making models, and broader community engagement. So this is really critical for us. When we had initially taken over, our board was constituted of 5 old white fellas primarily, to put it somewhat bluntly. They'd been in charge of the organization for a really long time through several cataclysmic changes. And so we started, first of all, by recruiting a board that would be more reflective and representative of both the work and the folks that were supporting the work. So we really emphasized diversity, lived experience in particular, and then anybody in the general community who might be able to bring some value to the work. And so sort of the model that we were providing and working with guests and then working with our direct care staff trickled up in terms of how we are navigated. So for example, the board started adapting various committees, finance committees. Engagement became really important. So there became a volunteer requisite so that they could get an understanding of the programming themselves. And then the decision-making, we sort of reversed. So previously we had people who had no concept of the work or the organization trying to develop policies and then pass them on from on high. And instead now the policies are developed with people on the ground level, and then finally brought up to the board for approval, which at this point is essentially a rubber stamp, because the recognition is that the people making the calls are the people who know the work. So it's all become quite democratic, with a real emphasis on having people with lived experience or people currently in the circumstance having their voices heard, and ensuring that they're taking the lead in terms of our change model.
Great. Does anyone want to talk about how anything has changed around governance for board for the COC, or how you've tried to bring those governance boards along with these change processes?
Yeah, sure. So, we do have people that are on, well, advocates and board members that are on the Reimagining Interim Housing Work Group. And the efforts, again, it's not just again the board or the COC staff. Our membership is comprised of those same folks that are holding those seats. So it is basically a full-on circle of advocacy and change, and wanting to create change, and advocating for change and implementing change. Within our board, we have PLE seats as well. And it just comes full circle. And our PLE Action Board itself has members that are on both the COC board as well as in the Reimagining Interim Housing, our Equity and Inclusions Committee, our Racial Equity Work Group, our Data and Evaluations Work Group. It's full circle. Everything comes full circle for us. So there's always voice in everything.
Okay, great. I know one question got answered in the Q&A, so that's great. I'm looking at the chat box too. Ryan, maybe you could address how you thought about the design features of interim housing, and did you factor in universal design features rather? And then there was also a question about pet policies. And I think you already flagged that the sites that you're funding now allow people to have pets with them, but if you could talk about that as well.
Yeah, quickly on the pet policy. Yeah, we recognized early on that's a barrier. We've heard that from many avenues of clients about like congregate shelters not accepting pets unless they were like support service animals. So we intentionally designed our sites to allow pets and encourage having pets, and provided like those pet relief areas like I was talking about. Our operators also provide like supplies around pets, and like educational workshops for how to like take care of your pet, or things like that. So regarding the universal design features question, that's a good question. We work with our public works department at the city of San Jose. So I'm with housing, and public works works on designing the sites for us. We've provided feedback about a lot of clients we've seen in our emergency interim housing through these past 5 years have needed that sort of accessibility. Maybe they weren't in need of an ADA unit specifically, which are few and far between. But they just needed maybe grab bars inside of the unit, or they needed like a shower that didn't have a huge ledge to step into, or seats in the shower, things like that. So we are taking that into account as we build new sites. We are trying to install those things where we can in current sites. And we're also thinking more strategically around where clients are placed in our sites and dividing like amongst subpopulations. So senior with medical needs, we're going to prioritize for sites that have like the in-suite restrooms and the different accessibility features that you're kind of asking about. I hope that answers your question.
Great. And Tim also wrote an answer to that question. So for the person who asked that question, I think it was Richard, you can see Tim's response as well in the Q&A box. Question has come in about the use of the term interim housing and whether we're concerned that it might create confusion or people might frame it as a housing investment, which could unintentionally take away from permanent housing investments. I'll just quickly respond to that if anyone from the community wants to talk about how you're kind of addressing that challenge. We were absolutely very concerned and conscious about that as we made this shift, and we have tried to be very purposeful in whenever we talk about it, and it's explained in detail in the publications, is that it is interim housing. It is the place where people can be while they're able to then secure permanent housing, and that it in and of itself is not adequate to end homelessness, but needs to be connected to a larger system for connecting people to permanent housing opportunities. But share the concern that some people can take words and try to apply other meanings to them. So we've tried to be very careful about that, but recognize there is some risk involved in that. For folks from either Western Mass or San Jose, anything you want to add to sort of how you've thought about that balance and avoiding confusion?
Yeah, I mean,
Can I?
sorry.
No, go ahead, Chandel.
I mean, while interim housing is it's a critical component, right? While people are in that transitioning phase, in addressing immediate housing needs, it really is vital to ensure that we don't detract the essential investments for permanent supportive housing solutions. And in all of this really does exact that we need to create a strategic, balanced approach that can help address both short-term and long-term housing challenges effectively.
Great, Claudine.
Yeah, I just wanted to add real quick because this is also emphasized in the framework materials. I definitely think that there should be ongoing conversations that emphasize and reinforce the message that interim housing investments are not a substitute to permanent housing, but a complementary strategy on this, a person's journey from homelessness to being placed in permanent housing. I think that so kind of like from Shondel's point, interim housing should be leveraged as part of overall efforts to end homelessness, but not viewed as an end in itself, if that makes any sense. So I think, and this is also a point emphasized in the framework materials, is interim housing cannot succeed without permanent housing, because people have to transition out of out of interim housing into permanent housing. So if you stop all efforts to continue progress in building a permanent housing, then people are going to be stuck in interim housing and have nowhere to move. So just wanted to add that.
Great, appreciate that. Jeff, a question came in through the chat that I'm hoping maybe you could tackle first. Was how do you address the need of staff for psychological safety within an organization as you've gone through these processes? Have you had to sort of address how people perceive their safety and their ability to contribute to these conversations?
That is a great question, and three things come to mind. One, kind of the premier tool of that would be an employee resource group program. And that is the subject for a whole different webinar, but I would encourage you to kind of pursue investigating that if that is something you're doing, which is essentially to create employee-led spaces based on different categories of affinity, which can include common experience, common identity characteristics. And those spaces can be used in a range of different ways, from advocating for organizational change or simply being a social space for connection. But it allows opinions and perspectives and causes to surface within an organization in a way that promotes a sense of safety and allows people to feel supported in that space particularly. So that's a recommendation. There's a lot of really interesting work right now taking trauma-informed principles actually to performance management and HR work. There's some really fascinating work being done in that space, things as simple as making sure that if you are having a coaching or performance management conversation with someone, that you are either both standing or both sitting, but you don't have a power dynamic of an imbalance while even having that conversation, for example. Little touches like that applied consistently across an organization can also really help as well. There's much more I could say on the topic, but we'll start with, I'll underline 3 times employee resource groups.
Thank you, Jeff. We'll take one more question, which I'm going to paraphrase, but came in through the Q&A, that there's been stories in the media about financial mismanagement, some of it accurate, some of it misrepresented, and folks who have an agenda of defunding services have seized upon it as an opportunity to make that case. Are you seeing those kinds of stories play out in your communities? Are there ways that you're thinking about the politics of that and the need for financial transparency, or other ways to make clear the sort of the strength of the investments that you're making? Does anyone have any response to that?
Yeah, I have a response. Something that we tried to take a proactive approach to an internal audit that was done for the city of San Jose. And in doing so, we're trying to be more transparent around the data on our sites and make it more digestible for like the layman, essentially. So ensuring that the public, when they see our data, that they understand how to interpret it, it means something to them. And so in doing so, we're working closely with some more data-driven folks in our department to create a dashboard that's going to be able to relay that information on how, like, not just the emergency interim housing sites are doing, but other programs the city of San Jose puts on that may have had bad publicity or politics around, like the spending that's been done within the city. So definitely something, I think other jurisdictions have experienced, and I think just taking that proactive approach and trying to stay data-driven, and then also provide any context where it means something, because we're working with people here and they have stories, and that's something that we're constantly trying to relate to our council and to the general public. So that's how we are approaching it.
Great, thank you, Brian. Well, we're coming on the end of our time here. If we can go to the next slide, please. Just really want to thank all of the folks who spent time preparing to deliver these presentations together. They were incredibly informative and direct, and I also appreciated people's vulnerability and willingness to talk about kind of what they're still struggling with or where the work was hard. So just really want to thank the presenters for their continued dialogue with us around these difficult issues. And I really also appreciate the dialogue that happened in the chat box around language and terminology and other things that this is, I think, the very kinds of conversations we need to be having more and more of. So appreciate folks participating. If you had a question that you didn't get a chance to put into the chat box, you can email me questions at matthewdoherty.consulting@gmail.com, and I will try to make sure someone on the team is able to respond to that. And just really want to thank everyone for participating, and anyone else on the panel who wants to say any closing words.
Thank you for joining us, taking time out of your day to join us for this hour and a half. We really appreciate it.
Right.
Yeah, just continue. You cannot ask to hold space within community without holding space within community. So make space, have the difficult conversations, address the shortcomings and what we can do better, and just continue to do better. Thank you so much for being a part of this webinar today.
Great. Thank you, everyone. Very much appreciate it. Great job, guys.